Hey guys, it's Rochellerikas, and I'm here today to give you tip number 2 for surviving nursing school. It's going to be a little bit more of a educational kind of approach to your tips. It's going to be about acid-base imbalances. This tip's going to be broken up into 2 parts: respiratory imbalance and metabolic imbalances, because those are the 2 types of imbalances that you can have with acid-base imbalances. We are going to start off with, what are your normal Abg values? Abg standing for arterial blood gases. The main values that you want to look at is your pH, your CO2, and HCO3. So let's go over your pH. So your pH is 7.35 to 7.45, and that is your normal range. The lower the number is in the range, so for example 7.35, you're more acidic. And if you go to the higher end of the range, 7.45, that means you're going into the alkalinic stage. For your CO2, you're looking at the range of 35 to 45. And for HCO3, you're looking at 22 to 26. And for today's purposes, we are focusing on your pH and your CO2. That is your respiratory imbalance. And why is it respiratory imbalance? Because it's your CO2. If you breathe in, you're breathing in oxygen, your O2. And what you're breathing out is the byproduct, CO2, carbon dioxide. Alright, so that is your basic overview of the normal values. So now let's focus on the respiratory imbalance. Once again, focusing on the pH and the CO2. Step number 1, identify your pH. Where are you on the pH balance scale? Are you acidic on the lower end, or are you alkalinic on the higher end? And the second step is identifying where are you in your CO2 levels. Are you high at 45 range or low in the 35 of the range? The trick that has helped me since my first semester of nursing school is the mnemonic ROME, and that's R-O-M-E. That's respiratory for R, opposite for O, metabolic for M, equal for E. The first 2 letters go together and the second 2 letters go together, or the second set of letters. So R and O go together, respiratory opposite, meaning that your values are going to be opposite of each other. One is high, one is low. For the ME of Rome, that is metabolic equal, which will be covered in the next part 2 video of this nursing tip. That's metabolic equal, meaning that the values are both going in the same direction, either both up or both down. They're both really high or both really low. So in this case, we're focusing on respiratory opposite. So your values will be opposite of each other. Your pH, if your pH is low, your CO2 is high. If your pH is high, your CO2 is low. Drop it low. Okay, so let's give an example. I got an example for you to identify what it is. Alright, so I had a patient, pH is 7.35 and their CO2 is 50. How do I know if they are, what type of imbalance they're in? So what do? First step, identify the pH. Is it high or is it low? So it's 7.35. That means your pH is on the lower end of your normal range. So we're going to consider that as acidic. Now, step number 2 is looking at your CO2, and it's 50. I'm pretty sure in the normal range, 50 is way up there, because the normal range is 35 to 45. So we got something going on. That is definitely a respiratory issue. If your CO2 is off balance, really high or really low, definitely a respiratory issue. So 7.35 is acidic, and your CO2 is opposite and it's very high, then that can conclude to a respiratory acidosis. Alright? Now, example number 2. We have a patient, 7.45 is their pH, and their CO2 is 30. Alright, what's step number 1? We look at the pH. Their pH is 7.45. That's on the higher end of the normal range. So if we have a high number, lab value, we are in the alkalinic state. Now, it can only be respiratory alkalosis if your CO2 level is opposite and low. So what was our CO2 level? It was 30, and that's on the lower, way lower end of the range, because your normal range, again, is 35 to 45, and our value right now is 30, so it's really low. So that is respiratory alkalosis. Your pH was really high, your CO2 was really low. Respiratory alkalosis. So moving on, what are these patients going to look like? What are the common causes, and how do we treat them? Let's look into that. Okay, so let's focus on respiratory acidosis, guys. Remember, respiratory acidosis, really low pH, really high CO2. Opposite values. So what are the common causes? We have your patients who are COPD patients. We have your patients who are drug overdose. They're not going to be breathing, so they're going to retain all that CO2 in their lungs. You're going to have head injury. They're going to have neuromuscular disease, or they're hypoventilating. What is hypoventilating? That's slow, deep breathing. They are retaining that CO2 in their lungs. It's keeping their lungs acidic. What are they going to look like? They're going to be sweating. They're going to be pale. They're going to have headaches. They're going to have difficulty breathing, sometimes painful breathing, and they're going to have mental confusion. How do we treat these patients? We're going to definitely identify and then treat that cause. Because we can be sitting here treating all these symptoms, but it's never going to go away. So we want to treat the main cause. And we want to maintain an adequate respiratory minute volume. Okay? Good. For your respiratory alkalosis patients, what is going on with these people? Well, let's take a look. The common causes are severe pain, anxiety, brainstem disorder, PE, also known as pulmonary embolism, and overventilation if they are on a controlled ventilator. Respiratory alkalosis is opposite of what respiratory acidosis is. They are breathing out too much CO2, leaving the lungs really basic. So we're looking at patients who have anxiety. What are they doing? They're hyperventilating. They're breathing really fast. And these are the patients you see breathing into the paper bag so they can breathe back in that CO2. Right. Now, their clinical manifestations are restlessness, agitation, tetany, dizziness, tingling, and numbness. Alright? Especially with the numbness, you're going to have to just get on those, especially with your neuro checks. You do not want to see any numbness or any tingling, because that's like red flag. Okay, how do you treat it? Identify and treat the cause. Once again, having all these symptoms, you're treating the symptoms, nothing's changing, the patient's not getting any better, they're just spiraling down the toilet. Figure out what's going on first, like the main thing. Especially with those anxiety patients, maybe they just need some reassurance and some support. Nurses, this is what we do. We want to have holistic care. Patient-centered care. That is what we do. If all you need to do is just kind of be with them and give them your presence or silence or just physically just being there, not doing anything, and they calm down, good job. You did your job. So reassurance. And then decreasing your respiratory minute volume as well. So this has been part 1 for my acid-base imbalances. We went over respiratory imbalances, which covered respiratory acidosis and respiratory alkalosis. And what were the common causes, what do they look like, and how to treat them. I know this is not really as in-depth, but these are just the main things that you want to just know and drill into your head, starting from the beginning of your first semester all the way until the end of the semester. Some pointers that my professors have told me: we should always be aware of the common causes and the clinical manifestations, because NCLEX has evolved over time. Before, they would just give you some values and be like, hey, what is this? Is this respiratory alkalosis, acidosis, metabolic acidosis, alkalosis? What is it? No, they are smart now. They want you to know that already, but they also want you to know, all right, this patient is respiratory acidosis, but what are their clinical manifestations? What do they look like? And then they give you A, B, C, D. Are they sweating? Are they pale? Select all that apply. So they want to know those, especially those critical thinking questions. Patient comes in with dizziness and agitation, tetany, some kind of tingling and numbness. They've had severe pain for quite some time. What is this patient going through? From what I went over, they would be in respiratory alkalosis. NCLEX is evolving. You need to know what these basic rules are, what their normal values are, and you'll be set. So good luck. If you have any questions, please leave a comment. I will be giving two questions in the description, and then I will give the answers in the next video that I have for part 2 for metabolic imbalances. And I hope that this was somewhat helpful. When I review all these pointers that my professors have given me and reading my book over and over again, it just sticks to your head and you'll get it. Don't give up on yourself. It gets really complicated and there are so many other things that you want to focus on, but this is one of those main things, the imbalances. And if you get the basics, you'll be good. So I believe in you. You got it. Positivity spreading to you. I'm giving all of my positivity to you. You can do it. Thumbs up if you like the video. Thumbs down if you don't. But give it a thumbs up because that would be amazing. And subscribe. Bye guys. See you in part 2.